Hi, everybody. Welcome to the podcast Redesigning Normal. I'm your host, Andrew Southern, and today I'm joined by Gloria Berwick, who's the VP of Operations at Spring Hills, which is a healthcare continuum. Did I get that right?
You did.
Gloria, tell our audience a little bit more about Spring Hills and what healthcare continuum means.
Absolutely. So, the continuum of care represents the different journeys and paths that our patients will travel on through their experiences with us. So, we actually have a few different verticals that are all integrated together. So, we have your senior living communities with memory care, home care. We also have post-acute facilities, which are better known as skilled nursing facilities, as well as a population health management, which I oversee, as well as our management service organization, which healthcare better known is as known as an MSO.
Okay.
So with physician practices within it.
And you're overseeing all of those different
I do not.
segments?
I
Okay.
oversee the MSO, which is the management service organization, as well as population health management.
What is population health management?
I'm glad you asked. Not many people really know, and it's a very general term that's used a little interchangeably sometimes. But it's integrated medical and behavior care. So we look to close the gaps for high risk, high cost patients. So we use a lot of social workers, registered nurses, pharmacists, doctors, and we apply evidence based medicine to help not only help them with their medical decisions and guide them almost as a healthcare GPS, but we also break down the barriers of social determinants of health. I'm sure you're very familiar that a large portion of our population have social economics and psychosocial needs, and those create barriers for patients to be successful on their healthcare journey through the continuum.
Got it. Okay, okay. The picture is becoming clear. And I should say for the audience, Spring Hills is a big company, right?
Yes.
Tell me a little bit about locations, staffing. Like, what are we looking at here?
I would love to. So, our owner and founder, Alex Markowitz, founded the organization in 1999. It started as one senior living community in northern New Jersey, and it's now expanded to multiple states, which we have Nevada, Texas, Ohio, Virginia, Florida, New Jersey, and we have a home care branch in New York as well. Population health, though, which is a little bit more unique, those are all of our brick and mortar locations, and there's a few locations throughout each of those states. But what's really interesting is population health is more in the lives business than the bed business, so to speak.
Okay.
So we have no borders. We follow patients throughout the entire country. Our clients actually are the health systems and health plans that are concerned with how they're going to embrace value-based medicine. We're moving away from that transactional fee-for-service world, and
Okay.
we've been trying for a very long time. Healthcare, not we as in Spring Hills, but the entire healthcare continuum is moving into value-based care, which is really important to really understand all of the alternative payment models that exist and how to be successful within those. And I will say that Spring Hills is, I believe, ahead of the race. We're very innovative. Alex is extremely innovative. He likes to stay ahead of the pulse with everything going on, which brings me to, the thing that I find most interesting about your title of Redesigning Normal is, in healthcare, we redesign normal every single day. It's our job to be agile, and there is no normal for us. We're changing and adapting every single day. So although COVID was huge for everybody, it's our job as healthcare providers to make sure that we are up to date on the best treatment plans, protocols, regulations, and what's going on across the world.
That's amazing, right? Because sometimes I know that there's some friction when you've got a big company, right? In order to make changes in your program in one way or another, that can be difficult the bigger you are. So I imagine you guys have a really strong set of leadership that's able to come up with new ideas, try new things, iterate new things, right? Work them on the ground, either in a sample market or across the entire, all the markets. I don't know exactly how you do it. Like, how do you actually come up with, you've come up with a new great idea, something that's going to be efficient or it's going to help with the customer care in one way or another. How do you implement those ideas quickly?
Yeah, so to your point in saying that, it does start with leadership, but it's not about just having the best leadership. It's every level of associate that we have within our
Sure.
organization. It's building that foundation of culture first and foremost. So one thing that if anyone has the opportunity to look at the Spring Hills website or learn a little bit more about Spring Hills is we're very passionate about our culture. And every associate, no matter who they are, carries a care card with our care standards. And so that's the first important thing to note, that when you
Mhm.
have a strong culture, you're able to listen to your ideas of all of your associates, right? And that's where the ideas really start stemming from, is
Mhm.
listening. What are their greatest concerns? What are the patient's greatest concerns? The residents, what's going on in the world? Then bringing it up versus up down. So I think that that's a
Sure.
really important thing to note, because everybody can think that, leadership sits in an ivory tower and just comes up with ideas and barks them on down. But that's not the case here. The
Yep.
culture is so strong that everybody shares their innovations together. And we do whiteboard sessions. We have monthly leadership meetings where we discuss that. And then when an idea does come, the success comes from creating task force. We have working groups, and nothing gets rolled out super quick, but we
Mhm.
also don't wait too long either. So it's just finding that right balance of what's too long to wait with this innovative idea, what's the priority, and how do we ensure its success. So by creating task force with the subject matter experts, and leveraging all of the great ideas of our associates, we're able to do that. But also training, accountability is huge.
Sure.
And you have to have a good culture to hold individuals accountable. So my answer to our success is our culture.
Okay, got it. And actually, a sort of this is a good segue into what I think many have found to be one of the largest stresses of their corporate culture ever, which is a 100 once every 100-year pandemic, right? Like when you've got your culture, you've got your decision making, you've got your normal way of doing business, which in your case is actually redesigning things all the time, which is fantastic.
Absolutely.
But as this outside pressure comes on, let's say February or March of 2020, what did you see coming? Like, when did you see COVID coming your way? When were you made aware of it? And then what did you guys do?
I would say that we were made aware even before it was extremely public. And I'm going to be a little jovial when I make the comment. There was these little articles and newspaper clippings. They weren't the big headline, but you would see little articles of things going on around the world before it was actually being talked about.
Sure.
So we do have quite a robust infection prevention protocols and expertise is on our board. So we did keep an eye on that earlier on, and I think that's our job in healthcare. Again, is to always stay ahead of what's going on. Really exciting. We were in one of our senior leadership meetings this week, and I loved one of the quotes that was brought. We bring a lot of reflection, and it was Wayne Gretzky, the hockey player, that said, that he goes not where the puck is, but where the puck is going, right? So
Sure.
it's our job to always see where that puck is going, and be able to be less reactive
Hmm.
to it. So that's so very early on to say. And what's really interesting is, as I mentioned, I oversee the population health division. We had not launched yet, so our
Hmm.
launch date was scheduled. Um, we were in the middle of training and onboarding all of our new recruitments and associates, and training for our launch that was supposed to happen in 2 weeks. We did that, and then the governor shut down our state and said no non-essential personnel in the building. And since we could theoretically do our jobs remote,
Hmm.
uh, we we had to change our whole plan. So we launched with COVID. Our very
Okay.
first patient that was enrolled into our service um, launched remotely from home, and we did go through some adaptations. But again, I don't think they're peculiar to our industry. We know how to adapt, and I'll be honest, in healthcare, nurses, clinicians all the time are faced with these challenges, and that's why we got into healthcare. We knew
Hmm.
that there were patients that relied on us. Our population relies on us to be this way. And I wouldn't want to give them any discomfort in thinking that we weren't prepared, because we always are prepared. We live
Sure.
every day as if something could happen and we need to be ready for it.
Does that mean that you had like all of the PPE that you needed already just in the sort of normal course of business, or did you have to go run out and get it?
We absolutely had to increase our buying power,
Right.
but we were very blessed. We were very fortunate in the circumstances that either, we had, GPOs and great contacts and organizations that we could leverage. We did not fall into a shortage situation, and I say that with empathy because I do know that there were a lot of organizations that weren't so fortunate.
Yeah.
But we were blessed in the way of we did have what we needed to supply our associates with during the COVID-19 outbreak.
That's great. And that keeps your team safe and it keeps your patients safe and it gives everybody peace of mind. I know that there were other businesses, even in healthcare, that were really struggling to find just, the plastics, right? And the
Yeah.
stuff that you needed, right?
Yeah.
But I guess you guys are a bigger company as well. So maybe have a little bit more pull to get stuff.
Yeah, I think that, I think that's always key too. But also, when you are a healthcare organization, you have access to GPOs and you have
Hmm.
distribution lines that you can leverage. So when you first hear something's going on, I'm not saying you panic buy, but you do make sure that you're ahead of the wave. I will say though, organizations that had extra, I think that was probably, although it was a horrific situation to be in, I think one of the things that I loved seeing the most during the pandemic was the sense of it takes a village.
Hmm.
I saw healthcare organizations donating to other healthcare organizations. We did it. I know in certain circumstances where maybe we were a little short on something and someone had a little bit more of something.
Sure.
There was opportunities to work with our vendors as well as our other healthcare providers. So I think that, even competitors, watching that interaction and everybody working together was one of the cooler things that I've seen in my time during healthcare.
Sure. Absolutely. So all right. So then what happened sort of after the initial wave of COVID? What did you guys have to do in your facilities? Did you keep them open to only for certain kinds of patients? What did you do?
Yeah, so no, I mean, we opened our doors to COVID patients. We embraced the COVID patient population.
Hmm.
Um, we wanted to help take the strain off of our health system partners. So we're in New Jersey. It's a very condensed population and a lot of hospitals, and a lot of them became overrun very quickly. So we were able to cohort COVID patients into our facilities, which was, obviously one of the misconceptions sometimes that media sees these high numbers of COVID-19 patients in nursing homes. But what the media may have left out, or definitely left out, was the fact that we opened our doors and accepted these patients to help offset the pressures that the hospital was feeling. So patients that may not have needed a vent or an ICU stay that would have been stable in a skilled nursing facility, young patients that we never usually see
I
even,
see.
we opened
Right.
our doors.
And that like got counted as a case in a nursing home.
Correct.
Okay, it was all like lumped together, but in fact you had extra capacity, and that is the right thing to do,
Correct.
right?
And we
Okay.
actually, then what we did, and where the fortune, we were blessed again that we had population health start at this time because what we were able to do was cohort patients. So the patients
Hmm.
that had the COVID-19 positive were able to come into our facilities. And the patients who were not COVID-19 positive that were able to be cared for in a less restrictive environment, such as their home, population health management was able to provide and all of the resources they needed and coordinate the care so that they didn't have to burden the facilities, such as the hospitals and the nursing homes. So, what
Got it.
if you ask what population health is? We sent nurses, home doctors, home paramedics. We did all of the care in the home setting during COVID, and no patient missed a beat.
Got it. Okay, I'm starting to understand a little bit more. So you guys actually have vehicles what move around to go to people's homes.
So no, we don't.
Oh,
The population health is remote. We
oh, it's
do
remote. Okay.
we do have home care, which home care deploys nurses and home health aides to our patients in the home. So they are in the home setting, and then we do partner with mobile paramedic units to help
Ah,
support.
okay.
So,
Got it.
so it's a coordination of care, but we personally we employ our associates, our social workers, registered nurses,
Yep.
doctors, physicians to triage and work with all of these providers to get the patients what they need.
Got it. Got it. So it's
Hmm.
okay. Again, I keep saying this, but like it's a very big company, so I'm just trying to get my head around all the stuff that's going on.
Absolutely.
Um, okay, so then what does it look like if I came to visit a facility? What would that be like? Would you like take my temperature, put on a mask? Like what was required over the summer, for instance, that maybe wasn't in a normal summer?
Well, so you wouldn't have been allowed in our building.
Okay,
So I apologize. You wouldn't have even made it through the front door.
got
We
it.
did have to close to visitors. There was different levels dictated by the Department of Health. Sometimes, we would get oh, it's okay, to have outside visits. It's okay to have little visits. And then it was, nope, shutting everything down. So you really had to follow what was going on with the regulations of the Department of
Right.
Health and also federal. So it was a balancing act, but we did remain closed to all visitors, including families, which was a very depressing
Hmm.
time for our residents, especially those short term skilled nursing patients that only usually come in for a few weeks of rehabilitation. It was very difficult, you know, for them to
Sure.
agree to come in because they knew they weren't going to see their family.
Wow. And then how long? When did that end?
Uh, just a, just recently, we
Really?
this stopped a few months ago. Yeah, yeah,
Someone,
unfortunately.
someone I was speaking with had told me that there was a sort of like they call it a window visit.
Windows, yep, we did a lot of
You
window
did
visits.
that? Yeah.
Hmm. Yeah,
That's amazing.
it's the best next step, but
Okay.
unfortunately, it doesn't replace feeling your loved one, that hug, that embrace, and we truly had to learn how to love from afar during COVID, and I don't think that wasn't unique to healthcare. That was all
Sure.
of us with our families. Um,
Sure.
and it was very strenuous. So we do and are seeing a large number of behavioral health issues coming out of the pandemic. So post-pandemic, one thing that we have definitely seen is a rise of psychosocial issues.
Yeah, I mean that's something I've been talking about this on this podcast for a while now. That there was sort of three bands of folks. The first band, maybe I'll put them up here, was sort of ignored maybe some of the best practices for stemming the tide, and then the folks in the middle kind of like they wore their masks, and then when they were told they didn't have to wear them anymore, nowadays they're not wearing them. And then there's a group of people that were really frightened by this, and it's still to this day. And we're talking now in June of 2021,
Yeah.
we're still traumatized by this, right? So there's a certain amount of that trauma that's running through the populace
Yeah.
at all the time, right? And so that's actually a lot of the responses that I talk when I speak with business folks is trying to speak to that population because those are the last folks that we need to sort of coax back out again. And it may be too soon now, but in the near future, those folks are coming back out and they need to feel comfortable,
Yeah.
right? And then safe.
And it's baby steps for sure, but we still have that. So you have your patients that, and again, that's what that population health is for, is making sure that patients are getting what they need from the healthcare continuum. And we are finding patients that need to get to doctor's appointments that are still fearful, patients that need certain procedures or surgeries and are still fearful. Luckily, we're able to support them in the home environment with, and keep certain things stable, but when it
Hmm.
comes to certain changes in condition, they have to go back to a hospital, and there is a fear of that. We are using a lot of home psychology and psychiatry services. We're doing a lot of telehealth services, as is the rest of the country, to
Sure.
help support that. But again, we're bringing providers and coordinating providers to come into their homes for those that are still a little bit more fearful to come out. And what we're also seeing is those that didn't want to come out for a long time and are starting to get ready, they're not at their baseline anymore. There's a
Right.
lot of deconditioning that's occurred over the last year, and patients that were needing maybe elective procedures now don't qualify. We have to get them back up to their baseline and strength to be able to get the procedure that they needed. So a lot of
Wow.
deconditioning, a lot of health risks. So we talked about the mental health issues, but there's a lot of physical health issues that have come out of it as well. Your lower extremity weakness, people aren't walking
Right.
around as much. So yeah.
especially for, I mean, for older folks as well, right? I mean,
Correct.
beyond the fact that there was this pandemic and everyone was stuck inside, a year has passed. Right?
Correct.
Everyone's a year older, or
Mhm.
15 months older as well. So your patients got older during that period. I wanted to pick up on the telehealth a little bit. Were you guys big into telehealth prior to COVID, or did this kind of amplify that effort?
Yeah, so we've been involved in telehealth services and exploring how we were going to grow that even prior to COVID. So
Sure.
it does give you that little leg up.
Right.
Telehealth has actually been around for a very long time. Unfortunately, it was only embraced by organizations like us that do chronic care management or population health management. Certain doctors were less eager. So what I will say is the providers we work with, our collaborating physicians, embraced it more than they ever had,
Sure.
which was super exciting because we couldn't get them on the bandwagon to use telehealth until there was really no option but to use it. So now we're seeing all of the physicians that we're working with really jumping in and utilizing the telehealth applications now, whereas before they were a little fearful of dipping into new waters, but everyone
Right.
has. Hmm.
That makes sense. Yeah, you got to get the doctors to sort of sign on to this. And like you
Yeah.
said, there was no other option. If you want to see patients, you got to do it online for now. That's one of those things that I feel like su- potentially survives beyond COVID, right? The idea that telehealth is a reasonable, accessible means to get some medical attention for some things.
Absolutely. So, and not to get down a rabbit hole, but I'm not sure what you know about, reimbursement models and everything with telehealth, but we
Tell
call it,
me, tell me.
okay, so we call it, the genie was let out of the bottle. It was a very awful tragedy what was going on in the world. But for telehealth services, they opened up a waiver that you could then provide telehealth services even across borders. Before it was restricted to states. So
Hmm.
you needed to have licensure in the state of the patient that you were servicing. And we were able to break that down with the waiver. And there's still a lot going on with legislation and bills. So I'm not going to, forecast yet, but we
Sure.
are predicting that the genie is going to stay out of the bottle, so to speak, and that this will remain open, an open opportunity. Now, I think that, there's some questions about, reimbursement models changing because right now it's still billed at the same level of care as of actual physical, visit certain things.
Right.
But yeah.
Got it. Right. And so without getting into like the sort of the model of it, I guess maybe the idea is that a telehealth visit could be a slightly less cost because there's less
Correct.
facility involved in it or something.
Yeah,
But,
correct.
or there's more efficiency built into that, right?
Hmm.
I would imagine. I mean, my dad's a doctor, and he's been
Oh,
seeing
nice.
patients for however a long time, and I know that for him, the sort of gold standard is sitting across from somebody and talking to them about their health,
Sure.
right? However, I will say that he has also embraced telehealth during this time, and he's been able to see patients from the dining room table.
There you go.
So,
And I think that's where we had the leg up because population health management has always used resources like telehealth and has always been telephonic. One
okay.
of the first things that come out of my mouth when I'm interviewing a new nurse for population health management is, look, the nurses I know, they like to see wounds, smell wounds, they like to
Hmm.
get up and personal with those wounds.
Hmm.
I don't see why. But if you're not ready to take a step out of that hands-on live patient care, then you're not ready to come on to population health management.
Okay.
And we've been doing programs like this, or I personally have been doing programs like this since 2014.
Hmm.
So this isn't new. It's just finally being recognized and understood that there are all these capabilities to keep patients in a least restrictive environment and home.
Amazing, amazing. So as we're coming out of COVID, and I think the data supports me saying that out of my mouth just now, that like we're coming
Okay,
out of this. Okay,
there you go.
I hope. Beyond telehealth, right? Were there any other things that you think will continue that you did during COVID that you think would sort of stay on after this threat has passed?
Yeah, we're gonna stay remote.
Hmm.
That's the biggest thing I would say, and I think that's not unique to any industry, but because we were already a remote call center, so to speak, we would have to host all of our nurses and social workers with cubicles and a lot of square footage
Sure.
to accommodate the call center. And now our call center can be spread out throughout the states, and which is wonderful. And we actually found that productivity has increased, morale has increased, that drive time that, once, they don't have that anymore. So they're ready for work. It's really been quite great. There were some tweaks, I did
Sure.
right away. We do like a morning coffee time every day right before we get started. So we all jump on our Teams meeting, and we call that our stand up. Again, that's part of our culture. Every
Sure.
morning, all of our organization does a stand up where we go through some really interesting fun facts, birthdays of associates, etc. But we also, we plan our day out, but we do it together. And it also helps that void. You don't get to bump into each other in the break room anymore. You
Sure.
don't get to have that morning coffee where you're all getting ready to start your day. So it is our stand up, but I also like to be jovial and call it our coffee time. So
Sure.
we enjoy that time together.
Got it. So how many folks are in the program right now? Team members, I mean.
Uh, for population health management.
Yeah. Yeah.
Oh, so that's a loaded question.
Oh,
16 full-time associates, not including all of our associates that we share with other verticals.
got it. Got it.
Yeah,
That's
because we do
awesome.
have access to the clinicians in our other verticals as well. So, which
Right.
is
And so
wonderful.
all those folks can be at their home, remote.
Yeah,
That's
correct.
amazing.
And that'll change. We are growing rapidly, which is a wonderful thing. So I will say staying remote has helped ease my mind on our scalability.
Sure. Of course.
So it's a very scalable model regardless. So as we're bringing on new clients, which we are this year, I'm less worried about how we're going to scale the bricks and mortar aspect of
Got it.
it.
Got it. Yeah, and I know that a lot of other industries have had like it's hard to find folks to scale, right? Like new team members. But I think
Yeah.
that hopefully is a temporary problem, and that there'll be a lot of people that will be
I
coming.
Yeah, so I will say for our facilities, it is very difficult, and I don't think this is wrong to say, but it is very difficult when you have certain patient to staff ratios that you have to meet
Hmm.
from a regulation standpoint. Then but yet your reimbursement doesn't change. So the federal government doesn't really change how they reimburse you whatsoever. But
Right.
now Walmart and other industries are hiring cashiers at $18 an hour,
Hmm.
but without that extra reimbursement from the government for our caregivers, you don't have somebody that wants to necessarily work for what we can afford to do the home care needs and the
Sure.
bathing needs. And it's so difficult. And we've come in a time where there's a lot of uncertainty with clinicians. They've seen such loss, right? And they've had a tragic year. Some of them really need a break.
Yeah.
But where we've been fortunate in population health is because of that remote environment, they still get to do what they love
Hmm.
without being on the floor. So I will be honest, we in population health, we have a pool of candidates to choose from who have almost a PTSD from working in the
Nice.
ICU units or the hospital units that just they don't want to leave nursing and caring for patients, but they
Okay.
just can't be on the floors of it anymore.
Sure.
So,
Somebody had mentioned to me compassion fatigue, right? That sort of thing where you're caring for patients day in day out, and it can burn you out when you're
yeah.
in that industry.
And family. So compassion fatigue is almost comparable to caregiver fatigue. So one of
Okay.
the things I say in our population health program is we have to wrap our hands around the whole family, because you think of that wife that's taking care of her husband day in, day out, who's taking care of her, right? And
Hmm.
that's the same with our clinicians. So that is so true what you're saying, that compassion fatigue. Who's taking care of our clinicians as they're taking care of everybody else? So self care became a very important aspect of Spring Hills during this time. Again, if you look at any of our social media outlets, if you look at, our website, you'll see that caring for our own associates is just as important, and we care for one another. But we were very concerned with that during this. And now I would say, we were all blessed that we had such great leadership that made sure that we were all very well taken care of during this time.
That requires a high level of emotional intelligence to identify that, right? And to really put your money where your mouth is, know, and make sure that team is doing okay, because that could be very, very taxing. There's a lot of industries that had a difficult time, but healthcare, of course, had the
true.
hardest
And
time.
we reutilized our social workers who are for our patients to create support groups for our own associates.
Yep.
So doing, and I'll even just speak to our last leadership meeting. We do leadership meetings once a month. And one of the things that we really focused on was, how do we use our own services for our own associates?
Sure.
Not just the lives that we're taking care of, but each other. So, one of the most attractive things for me in coming to Spring Hills, because I was able to work with Spring Hills as a partner before, was the culture. And that was something that attracted me. And I said, I want to work there. I want to work at Spring Hills. And I will say that that is the one thing that has kept our associates thriving through this awful time.
Sure. Yeah. Tough time. But like I said, I hope that things are getting better. And it's amazing to me that you have launched this program during this. Right? That's just like, what are you going to do? But as things get better, I'm sure that scaling will be a little bit easier.
Yes, it will. And I don't think that we could have launched at a better time when our population needed us the most.
Sure.
Yep. I'll simplify it. I often refer to population health as the healthcare GPS. I think I referenced that a little bit earlier. And what I mean by that is, when you get into your car and you put in a location, you know where your goal is, you know where you're going. Your GPS goes, okay, this way has tolls, this way has traffic, this way has neither of those, but it's a little bit longer, right? It's so important that we identify what our patients' goals are and where they want to go. And then we can give them informed decision-making options.
Sure.
So we can say, okay, this is your goal. Even if it's, I want to make it to my granddaughter's wedding, whatever that is for that person, okay, fine. Because cutting out chips might not be an option. So let's look at different things that we can do. Unfortunately, when a patient is newly diagnosed, and I'm not sure because your father's a physician, so, don't hold this against me, but a lot of times when physicians make a diagnosis, they also tell the patient what the patient's going to do and what the plan is, right?
Right.
Okay, you're going to do this, you're going to do this, you're going to do this. Where in that did the patient have a decision? Then we get upset when the patient's non-compliant. We get upset and go, well, they're eating salt. They're not standing on their scale. They're not doing this, right? So what we do is, through motivational interview techniques, we really work with the patients and their caregivers to really identify where their goals are and where they want to go. So during COVID, launching this during COVID was, I would assume, a blessing for our patients who were feeling so lost, so vulnerable, didn't know where to get care, didn't know how to get to their goals anymore because the whole system was disrupted. But knowing every loophole, regulation, twist and turn, we were able to guide them through their journey.
Got it. That's a great, clear picture of what you guys are bringing to the table. Sounds like people, the idea that you mentioned before about maybe someone's goal is, I'm going to make it to my granddaughter's wedding. Perfect example, right? And then you would give the patient, okay, that's your goal. You could do this to get there. You could not do this and get there. Like you give them the option, and then they pick which one they want to do, and then they're committed to doing that thing, right? Because you gave them the choice.
And if they don't, you can hold them accountable because that was their decision.
Right. Got it. That makes a lot of sense. There's a psychology to that, right?
There
Versus
truly
the traditional form that you mentioned, where the doctor says, right, you've got this thing. This is what you need to do in order to get better. Like it's this, and this. And that may be correct, but the way that you frame that, if you can give people a choice, you could also not do this, right? You could not do this, and this would
Correct.
happen, right?
Yeah.
And then
And
let
you'll
them
have to
choose.
put a different destination, unfortunately.
Got
And
it.
that's really, sometimes you do have to have those tough love conversations with your patients and the families, and you have to do it in a way that's obviously respectful and full of sympathy and empathy. And it's a very difficult balance, but that's where motivational interview techniques truly come in. But I will just say, even without that, we have such a great team
Mm,
of humans. We use technology to scale. We use machine learning, predictive analytics. We get all into the different types of technology to help us scale. But it's the human component that keeps us successful. That's our secret ingredient, right?
sure,
It's that relationship and trust that we build with our patients, that they trust us.
sure.
Um, Interesting, we had a patient call us from jail. I mean, that's doing a pretty good job. We were their one
Wow.
phone call. So, it's like, wow, this sucks that they're there. And thank God they called us, because they were on a medication that, if that's hard, oh my goodness. But regardless, that's how strong the relationships
Hmm.
are between our patients and our care team, is that, the guy had one call to make and
Right.
he called us.
Amazing, amazing.
Yeah.
It's sort of funny, right? Like that's a funny story.
It is. We're allowed to. And, I'll even give you another one, because what we do is just so awesome. We had one patient that really wanted our help, and his girlfriend didn't want him to get help from anyone else.
Hmm.
He'd sneak out and call us to get help because he didn't
Wow.
want to offend her. So that just shows you how deep you need to get to be able to build that trust and commitment with your patients, that they know you have their best interests and you're going to
Hmm.
guide them in the right direction and truly support them. And that's where we have the patient adherence. We often
Got
use
it.
this word compliance, and I'm not too much of a fan of that, so we'll say adherence, but adhering to the care plan, adhering to the journey.
Sure. Yep. So Gloria, how will folks that are listening, like, if there's someone listening right now that's interested in Spring Hills and the stuff that you've just mentioned, how would they find you?
Me
No,
personally?
well, sorry, how would they find your
Oh,
your services?
oh, I thought.
Not you don't have to contact you directly. They can contact through the
Well,
website, I
I'm an,
imagine.
I'm an open book. But regardless, we do obviously have our website, springhills.com,
Okay.
which has forms on there to reach out to us, and that would probably be the path of least resistance.
Awesome. Gloria, thank you so much for your time today. I really appreciate this discussion.
Absolutely. Thank you.
Awesome. Thank you. Have a great day.
You as well. Thank you.